we get these questions so often from educators. One, they want to learn more about the warning signs, what to look for, but also how to be able to support and create those safe environments for their students. So today we'll explore a bunch of those questions. We've got two amazing panelists who are joining me today. I'm really excited to introduce them. Zoe, would you like to go ahead and introduce yourself and tell us a little bit more about SunCloud?
My name is Zoe. I am at SunCloud Health. I recently got promoted to be the adolescent lead of the dietitian team. And I have worked for SunCloud for the past 4 years, which I am working with a very integrated team with all of the therapists, psychiatrists, nurses, and grade providers, all of them. And we are using like a lot of like evidence-based care, but also like integrating a lot of we noticed like SunCloud noticed that like a lot of the times with mental health, we are treating like one thing at a time, like kind of like substance use or like mood and like eating disorders and stuff like that. But we integrated all of them together, so hopefully like all symptoms get addressed at the same time. So that's why we have this integrated model. For the past 3.5 years, I have been running an adolescent PhD IOP at Northbrook and has supported a lot of like young adolescents and their families in developing a healthier relationship in this like very critical puberty and like changes in life, like back to school as well. I'm very like passionate about like being collaborative with my team members, being in a trauma-informed healthcare setting and also wanting to create a very inclusive space for people that across all communities that might struggle or need some support with eating disorder healthcare. So that's where I'm from. Thank you.
Awesome. Well, thanks so much. I'm really excited to chat with you today and to get your insights on everything. And then
Yeah.
I'm gonna pass it on over to my Ohio friend because I'm in Michigan. So we're not supposed to like each other, but we do. So Kais, would
We
you
do.
go ahead and introduce yourself?
Well, yes, I am a Buckeye. I'm over here in Ohio, and I work out of the Whole Institute in Cleveland. We are an eating disorder outpatient facility. I've probably been doing mental health for over 20 years, working with children at risk in various settings, including in school settings. So this is very
Mhm.
close to my heart. I think I've been in eating disorder. I don't think I know I've been in eating disorder practice specialty for about 8 years now, maybe a little bit more. And again, I do outpatient here. I also supervise and have interns. I also have a podcast that I will always plug that talks about eating disorders and mental health in general. Wait, I have a picture there. I'll put it in the thing later.
Oh,
But
perfect.
it helps me to capture these stories, provider stories like Zoe, and then client stories. So that's a big piece of this. And then on the other side, which is why Jason and I have been talking, is we are working on an initiative to continue to educate in the schools about eating disorder and disordered eating awareness. So that education is taking us into schools right now and teaching educators like many of you. And then we're also working on a healthcare curriculum with the hope of, oh, I'm on there twice, a healthcare curriculum where we can change what we're actually saying, how those messages are presented to young people, which we might talk about today. So that is me. And yes, I am a Browns fan, even after Sunday.
Yes, I'm very sorry for the loss on Sunday. That was rough. But hey. If we're gonna go off on a football tangent here really quick, my team is playing Cincinnati this weekend coming up, so we'll get revenge for you. I promise.
Okay,
Yeah.
please do. It would feel good. Yeah, down. But I know that's not
So
what we're here to talk about.
that was our sports tangent for the episode today.
Sorry, guys.
We'll go ahead and talk a little bit more about eating disorders now, since I know that's why we're all here. But one of the first sections that I wanted to explore based on the questions that came in is just understanding what eating disorders are and maybe addressing some of those common misconceptions around eating disorders. Because I think we so often have this one idea in mind of what an eating disorder is or what an eating disorder looks like. And that's the farthest thing from the truth. So I'll open it up to both of you. What are some of those common misconceptions that are out there, and what should educators know about eating disorders?
Um, I'll start off on that one, Zoe, and we'll trade off. I think the number one thing I want to communicate is that often you can't see it. And
Mhm.
this is what makes it so elusive, is a lot of times it's hiding. I think it's 6% of eating disorders are actually something you could maybe see in somebody's appearance and recognize it as an eating disorder. That's the physical side. The other thing where it hides is these are typically high performing students,
Mm-hmm.
athletes. They are performing at such a level that you may not recognize that they are able to do that and have what could be a full-blown eating disorder.
Yeah.
I always tell this really quick story that I had a client who was in high school, and she would have been what we would have called severe anorexia. She was in a state where she probably should have been in higher level, like Zoe's IOP, PHP. She was medically fragile. It was told to her and by her doctor team she was not allowed to do movement. But unbeknownst to us, she joined the cross country team and ran these heats, these really long heats, cross country's what, 2 years or more. And
Mm.
she broke a school record. And that's really disturbing when you think about how did she break a record running cross country, even though her body was on the inside dying and her brain was dying. So these people didn't even know in that setting that she was so close to her heart rate going so low that it could have actually killed her. And they didn't see it. So I think the one thing I want to communicate is you may not see it. I think Zoe and I will talk to you about how to be able to see it, but it is being able to vet it out when it doesn't always show up right away.
Yeah. So I would like to add a little bit on it. It's like just eating disorder does not discriminate at all. Like it could be any ethnicity, any gender, any body size. Like you would not be able to tell unless you actually try to dig a little bit deeper. And most of the times it is very stereotypical that like eating disorders are only appearing to be like underweight presenting. But we of course we know eating disorder appears in different shapes and form. It could be like anorexia, which is the most well-known eating disorder, I would say, but actually binge eating disorders has a higher rate comparing to anorexia. And also of course we can include bulimia in the mix, and these group of population who suffers from bulimia does not you don't really see a change in body size at all because they binge and purge. So like there is some like compensatory methods that like you utilize and which appear to be fine outside, but of course the same thing is you're really hurting inside, and people don't know that because they don't can't see it in your appearance. And also people kind of like think that eating disorder are often a choice. They like choose to engage in these behaviors, but a lot of times it's not really just about food, weight, or appearance. It's a lot more about the coping mechanism that's tied to a lot of emotion, trauma, and stress. Like as a dietitian standpoint, of course, like having some structure and help support around that is helpful, but also like the incorporation of like mental health care providers, like from counselors, therapists, and then psychiatry from that standpoint is also very helpful. It's not just about eating. It's a lot deeper than that, and it also does not discriminate.
Yeah.
And I love that Zoe said that, Jason. Oh, sorry.
Oh, go ahead. Go
We're going to
ahead.
get so excited that we're not going to stop. But to piggyback one more time on that, and I loved it, is that it is a brain disorder. And I think that's a
Mhm.
huge thing. Yes, the body's involved. Yes, there are changes, but the hijack is in the brain. It is
Mhm.
what happens to their brain physiologically and emotionally and cognitively that makes this such a tough disorder. That's why, again, you won't always see it.
Yeah.
Yeah, one of the things that I often share when I'm sharing my story is that food was just the tangible evidence that something was going on, but it was so much more than that. Like it was not about the food at the end of the day. And there were so many compounding factors that were going on. And I think that's what makes it so difficult sometimes to recognize the warning signs of eating
Mhm.
disorders. So, what are some of those things that educators could be on the lookout for, especially if they've got students maybe who are trying out a new diet or testing out a new eating plan? How can you recognize some of those warning signs that, hey, this might be going a little too far?
I will take that away for a little bit first. So some things that I would say is very like early warning signs is like people might start to have very rigid rules, routines, or rituals. So kind of like if like of course there are going to be times that like people want to try out different methods of eating, and like food does not have like a perfect answer. It's just a part of life. You cannot expect perfection from it at all, which is something that I want everyone to keep in mind. And this is not something that we can be perfect about. Which like, but some of the early warning signs might be like checking extensively with like food labels, doing calorie counting, Or it could be like a lot of like black and white thinking about like this food being good or bad, kind of like really cutting things out, like very like for example, like a whole food group, like very like distinctive rules about, oh, like let's say if this food contains like 5 grams or more fat, then like I'm not gonna eat it. Things like that. Could be like early warning signs or like just the fact that like hey like if like let's say if there's like a unplanned event of like things that's happened like maybe in school events is saying like hey like we all suddenly have like a breakfast for all morning and they're like oh this is like really throwing me off and I'm like not taking any like part of this event at all could be some early warning signs about like like people having a little bit more preoccupation with food and like they might be leaning a little bit towards like an eating disorder like way of like engaging a little bit more in that sense.
Well said. I agree. That was the very first thing I wrote down was rigidity, rituals, and rules. They
Mm-hmm.
almost always will be along. And perhaps also distress when not engaging in one of those. So it's
Mm-hmm.
one thing to have a rule and be like, I'd really like to avoid this. It's another thing to have it have an emotional reaction and also an avoidant reaction. I think you commented on that, Zoe. They might miss things or you might notice them not participating in social settings where they can't honor their rules or they'll be
Mm-hmm.
caught wanting to keep those rules.
Yep. Avoidance is a big part of it as well, definitely.
Yeah.
Yeah, that makes me also wonder, like from a behavioral standpoint, especially in middle school and high school, like I remember back in that day and age, like I was emotional, there's a lot of stress going on that students are facing. So how do you differentiate maybe some of the changes that they're going through just as a part of that transition in life or at that age in life? To what's more serious, that there's mental health challenges that are going on. There's an eating disorder that's stirring.
Yeah, I would say like one of the big things is like you would see a lot more isolation. Like one is like pulling away from a lot of like events that might involve food, avoiding family situations or family gatherings that has food. They like let's say they are originally hanging out with friends, but let's once they say like, oh, we're going to a restaurant, like they are trying to find reasons why to like not attend that event. Or like let's say if it's a birthday party, then we know that there's going to be cakes like desserts involved, and that could be a reason why did they avoid it, or like a couple continuous times that you're seeing that they're continuously avoiding those situations, that could be a warning sign. Another big one I would say is like doing a lot of like extensive checking, like body checkings are one of the big parts that could be turning to a little bit more obsessive. Like let's say if they are looking into like mirrors all the time, like continuously checking their behaviors, checking their side profile. Those are the things that could be a bigger, turning into like a more serious condition. Other thing, one more thing that's more pertained to like kind of like purging or like compensatory factors would be like always going to use the bathroom after meals. Kind of like finding like time so like every time that you're like eating something, you're trying to like plan for a bathroom visit with the attempt like with the attempt to like purge it out. That could be one of the things that you're seeing a little bit more serious down the hill that is actually evolving into eating disorder.
And I think to globalize this conversation, maybe it kind of covers everything a little bit, is eating disorders live in the silence and shame lives in the silence. So if schools start to have more open conversations, it won't be so perhaps taboo to come up to a student and say, I recognize a change. You may
Mhm.
not know whether the change is coming from depression, anxiety, or an eating disorder, but I think we need to recognize something's happening. And then we can get them to the professionals and the experts to help figure out what it is. But I think creating that culture, our children's self-esteem and the overall anxiety and depression numbers have gone up. It's over the past maybe 4 years. So being aware of that, and eating disorders have the highest, I believe, one of the highest mortality rates
Yep.
for suicide. So our kids are at high risk of self-harm, including that. So anytime you see something, the culture should be to address it and not be afraid to
Mhm.
talk about it.
Yeah.
So true. One of the questions that came up in my mind too is, what about grades? What about academic performance? Can you take a lot away there if a student is struggling?
Yeah,
Yes and no. Oh, sorry,
definitely.
Zoe, go
Yeah,
ahead.
go ahead, no worries. Like I would say, especially with like student athletes, especially with like LGBTQ plus students are at like a very high risk of having eating disorder, concerns, or like even like with students that might have like high perfectionism or like anxiety traits might be also very big part of it, as long as like cultural groups that like body ideals and food stigma could be like a big part of their culture is a great part of like the additional like risk or like pressure into people like wanting to achieve a certain body size, being more distressed about their body, how their food, or like even like let's say just the fact that hey, like we're using food as a way for reward, punishment, anything that has like associated emotional factors of it. Let's say like anytime that we're sad, we like give provide food. Anytime that there is like emotional events, like we are associating food with it, or like we're associating food with love, food with care. You have to finish whatever is provided to you, and in order to be like respectful for the family, respecting of the love, that could be very big part of the reasons why they choose or use food as a way to control. But of course, like there is like a big part of it that has to address is the backstory or like the mental stress that is like coming a part of it, like I said, because of depression, any trauma experience that they have not told to other people, and it oftentimes live in secretive, but also those are the people that we do want to have a little bit more awareness, or like want to ask the question a little bit more often, especially in like student athletes as well, because there are a couple sports that is very focused in weight. Like for example, wrestling, gymnastics, like dance, figure skating. Those are the top tier athletes, student athletes that might struggle with an eating disorder as well.
Yeah, one of the big at risks, as you said, Zoe, is high performing in both grades and in athletics. And again, you may not see it. So for grades, most of my clients, I have a lot of clients who are teens into college, they're top of their class. They're
Mm-hmm.
taking AP courses, they're getting 4.5s, they're getting fives on their AP test, they're getting into the top-notch schools. Again, it's kind of hidden. You think this kid's okay. That is
Mm-hmm.
your at-risk student because they probably have taught themselves to perform in a perfect way. It's easy for them to give themselves that criteria. It's typically not coming from you, the educators or the parents.
Mm-hmm.
It's from inside them. So
Yep.
yes, they're at risk, but to your point, Jason, or your comment, it's hard to know by grades. I don't know if you see a flagrant change, that could be an indication,
Mm-hmm.
but we'll probably talk about later. The grades will be affected more when they get care and they're in a
Mm-hmm.
higher level of care setting where then we
Yep.
do as educators and providers have to help them stay on track.
Yep.
That's not a great answer, but I don't know that you're going to see it that way.
Yeah, not really. I would say there are going to be times that people's grades does plummet and their performance does plummet, but more of the times it's already getting pretty bad or pretty serious. But when it's like early stage, it is eating disorders are very secretive and they are difficult to spot. Is definitely one of the biggest concerns. Like people don't really come to us until their blood labs and the PCPs say like this is a little concerning, or like their nursing or say like the nurses are saying like hey, like this student are coming to us like quite a few, like almost like daily, saying that they're like having headaches, dizziness, fainting, things like that. Only when we actually see like some physical symptoms, most of the time they're pretty secretive. So you can't really see that in like performance and grades unless it's like further down the road.
And there's this really amazing thing called starvation syndrome.
Mhm.
And it's really cool. As humans, it's built into us to be able to go without food. We have a beautiful protection in us that your brain, your body, your hunger, your fullness, 15 parts of the brain change in order for you to survive starvation. And it's a fascinating tool, but it's meant to only be used short term. So if one of us was in a situation, we may not like you hear about people in those reality stories that are stuck on a island and they're okay for time, but it can't happen long term. And there's huge cognitive price tag and long term physical price tags. But that explains why people with eating disorders can function because their body stays in this suspended, almost like a fight or flight state again, long-term benefits and some scare negatives and some scary ones. But in the moment, they can get the grades, they can function,
Mhm.
except for a few of their bodies, like Zoe said, might show up as seeing them in the nurse's office because they don't have a strong starvation syndrome connection.
Mhm. Yeah.
Yeah, thanks so much for covering that. Yeah, because that was one of the things. I was a super honor roll kid all through school, and everything I do, I was going to do it 100%. So of course, as the eating disorder started to take over, I was going to get an A on that too. I was going to be
Mhm.
100% at that, and I
Mhm.
see that all the time with people that I connect with in this community. Is that we were all kind of those straight A students and the
Mhm.
overachievers who wanted to be really good at things, and oftentimes. I can't remember who said it, but that pressure comes from within. It's not coming from professors or from teachers or from parents even. It's coming from within.
Mhm.
So this leads into one of the next questions that came in, but in what ways do eating disorders change how the brain perceives reality? So for example, how the brain perceives body image and the sense of hunger, sense of fullness, or self-esteem.
I'll start on that one because I just love talking about the brain.
Mhm.
I wish I'd have brought a picture I have of a client that built that, but they have studied that the physiology has changed and the cognitive part of the brain. But so there's been a push just to kind of elucidate this a little bit. There has been a little bit of a push to put eating disorders under the psychotic disorders in the DSM because what it does to the brain is delusional at times. It creates a different perception, a different reality. Body dysmorphia itself is something that has been studied in a real thing where their perception, their visual perception has changed. I think there are, and I just love these words, 15 parts of the brain that are involved in craving, food, satiation, hunger, fullness. The nucleus accumbens, insula, hypothalamus, pituitary, amygdala, prefrontal cortex, orbital frontal cortex, caudate, posterior cingulate, ventral striatum, just to mention a few. All of those, I know, I just love to do all that. Jason's laughing. All of those are involved in eating and in the eating disorder. So when it takes over that part, those get hijacked. They don't do their job right. And then the executive functioning and the perception side of the brain is also hijacked. So you have this entire, it's like it takes over them all, like invasions of the body, snatchers kind of thing. And the biggest outcome I think that you might see in school or that we see is insight and perception. So they might still perform, but their insight, their judgment, and their perception, that's where it sometimes comes out in the wash, are greatly hampered because of it.
Mhm. Like your brain might get a little even more rigid, like especially like if students like or patients get like their structure a little bit like messed up, or it could result in a lot bigger emotional or like mood swings, or a lot like bigger of like a reaction instead of like what like a person that does not have that preoccupation or rigidity might react. Like let's for example, if like let's say like for example like this morning there was no the one kind of cereal that they were eating like for like the last 2 months, right? Like it ran out, and there was also like not the low fat milk was also like not present. They might actually have emotional breakdown over that like very small change. That could be a big sign of the rigidity, or like there's like some maybe it's just like some changes and like schedule in that day could also be a part of like the big changes with that said. So those are some like minor signs that we can like kind of see like ahead and saying like, hey, like maybe the brain is being more and more rigid and needing that like same exact like structure in a day-to-day basis for it to function and for it to like stay okay. But that is not like how a normal nourished brain would look like in terms of like that would does not have a preoccupation of eating disorders. So those are the things that I would say definitely is like how your brain is changing. Like when you're in a starvation mode, everything is numbed out, everything is like only in your baseline functioning. You don't really have much of that availability to deal with like additional things to throw at you. And those are definitely one of the big signs that I would see. It's like people's students' tolerance like got a lot more lower with like additional stress. Like let's say, oh my like time of like this assignment time was like changed, like even that could mess up their day. Like things like that could get more and more rigid, and those are the part of why we are seeing like eating disorder is really having a big toll on the brain when we're not nourishing it in a proper way. So that's which that could also turn into like let's say like having more like body image distortion. They might see themselves very different from their reality, which we're calling that body dysmorphia, which is what you're seeing. It's very different from like what the reality is looking like, and you might see yourself a lot in a different body shape and size compared to what it actually is. And that's a little bit because of your brain is unable to process what is currently the reality and also like have a lot more toll in like what might either one keep the rigidity and keep the eating disorder alive because that is currently the main drive that's in the driver's seat right now. So like it's focusing on how to one make you like having your body how to survive this period of time this under starvation, but also two viewing the eating disorder at the same time. So it is a really tricky situation when it comes to the brain and like changing the perception as well.
I think every one of our clients mentions not only a lot of anxiety, I think that's just tantamount, it comes with it, the comorbidity is there, but the food noise. And that might be language you'll hear either from young people in your school or people you know. We talk about this noise in the brain, like a static, and it's a constant narrative about what I should and shouldn't eat, that I'm not good enough, that my body looks like this or doesn't. It's a constant, almost like negative self-talk that goes on. And that is probably part of what Zoe was saying. The brain's so busy hearing all that and it's so preoccupied, it doesn't have room to do its job of regulation. And so you might see a change in dysregulation in that.
Yeah.
Yeah, that's really good. And I want to get back to the food noise here in a little bit because that's another topic that we need to open up. We might be
Mhm.
extending this webinar here, people, but that's all right.
Just all day.
We got a really good question that came in that kind of ties into the next area that I wanted to talk about, and that's supporting the students. We've talked about eating disorders, but going back to maybe some of those high achieving perfectionist kids, how can teachers and educators effectively and sensitively support and help those students maybe before the eating disorder even takes over?
Yeah, I would say always this is like my number one say like the person that you're addressing or like the student that you're addressing might not even know that they're currently struggling with an eating disorder or might not register that they're currently struggling with that and they might be already like the eating disorder might have took over like some part of themselves without them like noticing or like they have not acknowledged that is happening right now. So I would always say like approach it with like care and curiosity, not like assumptions or accusation. That's like definitely one big thing that you want to go with. Like kind of like using like I statements, like this is something that I really feel like it's helpful. It's not like I see you doing that, like you're like showing up like this, not like that, but like more of like, hey, like I've been noticing like you seem a little bit more tired lately. I'm concerned. I kind of want to like talk to you a little bit. How are you doing? Kind of like starting off with like be showing up like with empathetically like having that care, like curiosity, but not like assuming that they are in like any state right now or like not assuming that they are not doing well from the very beginning, but kind of like approaching it in a very gentle way, saying like, hey, how are you doing? Like, what's up lately? Can you tell me a little bit of like how your life has been going? Kind of like going that approach, but like not pointing it out directly sometimes might get them to open up a little bit more easier at the very beginning.
And I think with all young people, we should probably ask permission,
Hmm.
before we assume that they want to hear from us or they want our agenda. Even when they come into my session, I'm like, this is my audition. You get to
Hmm.
choose whether or not this is the right setting. So
Hmm.
asking them, can I talk to you? Is it okay if I share something with you? Once
Hmm.
they let you in, it's kind of like the vampire idea. Once they let you in, you let the vampire in, then they're into your home. I don't know if you guys watch Lost Boys, but that's what that comes from. But always where you can allow them to have choice and agency, because this is a
Hmm.
stage in their lives where they're supposed to develop that. They're supposed to be empowered. So wherever we can give them control, at least over how the conversation starts, that's a place to acknowledge them and value them.
Yeah.
Yep. Awesome. Thanks so much for sharing that one. One other thing that came to mind when I'm thinking especially about the high achieving perfectionist types like myself is setting a classroom or an environment where you're celebrating the whole person beyond
Mhm.
just maybe what their accomplishments are on an assignment or on a test. Because for me too, that was just feeding into it. That was making me think, okay, my value is based on the grade I'm going to get on this assignment or in this course. And
Yep.
just helping your students recognize that that is not their sole value. They're never going to be measured. Their worth is never going to be measured by the grade that they receive.
Mhm. Like
This
a
is my
lot of the,
card. I don't know if you guys can see it though. Can you see that card?
Oh yeah.
yeah.
So this is what we hand out at schools, and it's all food is nutrition. So the idea here is that these blanket messages that if we're talking about food, it's just nutrition. It's not good, it's not bad, it's not junk. Because our clients will take that very innocuous message of, oh, that has a lot of sugar, and they may not
Mhm.
eat sugar for 3 weeks because you mentioned it. They are that,
Mhm.
it's that quick. The other one is avoiding body comments. So we don't talk about bodies at all. We talk about
Mhm.
energy. We talk about, you look ready to start your day, you're energized, you're kind. And then finally, Jason, to piggyback on what you said, use intuition, not numbers. And that can be true about food too. This food intuitively makes me feel full and I enjoy the sensory of it. But also, are we qualifying and not quantifying everything these students do? Learning to get away from numbers. If we could not have grades, I'd be so.
Yeah.
That's another conversation, guys. But wherever we can reduce numbers.
Mhm. It's a lot about like focusing on their like well-being and functioning and how they're feeling on a day-to-day basis. Kind of like, yeah, like you can still perform like completely fine, but you can see that person is like not doing well. Like their smiles is like losing in their face. They have not been enjoying food like for the last how many times. Like the social aspect is starting to get a toll. Those are also some signs that you might be able to see as well from like high performing students because they're like very focused on like how can I still continue to achieve okay? And that's like my sole purpose. But like, and then things get to be things might be start to be lacking. Like for example, they might start not engage as much in their friends and like because of how they're preoccupied in their brain and why they're focusing very solely and like that's their eating disorder is also taking over. They have to like kind of like pick and choose, and most of the time the grades almost are the last thing to go on their list. So like I would say definitely take a look of like how like their overall well-being is looking, like kind of see like, hey, like it could also come up in some like other aspect in life, like maybe like family dynamics, maybe it's like social aspects and how if there's any isolation in peers and how they're interacting in group settings. Showing up in terms of like events, such like social events and group events that might involve food, like those are definitely things that you would see a little bit more earlier in that stage. So focusing on those things and approaching that in like a way of curiosity, asking for permission to like see if I can talk to you for a little bit, but also always go in an empathetic way and not accusing or like having any assumptions is going to be very important.
Yeah, fantastic. Moving along to one of the unsung heroes that's not talked about enough, but school nurses. What can school nurses do, not just to support the students at their school, but also be a resource for the teachers and educators at their school?
Yeah. I would say like definitely nurses would see the people that reports like dizziness, headaches, and like those symptoms like fainting like the most often, right? So like you kind of they kind of like get is the first people who say like, oh, like this person is showing up like a lot more times lately and their vital signs are not the best. They might be orthostatic. Orthostatic means like there's like a differences between blood pressure when you're moving around. So like or like sitting and standing up and might have a little bit of like blackout sensation when your brain is not getting that blood or like your body doesn't have the ability to like transport that blood in the because you might be like not nourishing your body in the right way or like be dehydrated, things like that. So like I actually would really hope or like help nurses to utilize like maybe some like light screening tools for like eating disorder. So for example, like Scoff is a very like easy like eating disorder screener to be used. And one of the ones that you can kind of like just type in and say like under the CEED, like SEED, the Victorian Center of Excellence in Eating Disorders, like have a Scoff questionnaire. So it's like SCOFF questionnaire, which is a very easy screening tool for eating disorders. It it encounters like 5 questions. Like, do you make yourself feel sick because you feel uncomfortably full? Have you worried that you lost control over how much you eat? Have you recently lost more than 1 stone, which is about 12 pounds in like 3 months? Do you believe yourself to be fat when others are saying that you're too thin? So like kind of like the body dysmorphia, preoccupation. And then also, would you say like food dominates your life, like kind of like take a lot of control in your life? So that is a very easy 5 questions questionnaire, and 2 or more yes of those answers would warrant a little bit of like additional setting or like needing a little bit more help. Like that would make, I would say like from that on would be appropriate to like maybe reach out to like the school counselor or like the school social worker to like investigate a little bit more for that particular student.
Yeah, I like the, and I love that you mentioned that. I don't know if NETA has the scoff too, but if you go to NEDA's source,
Hmm.
they have a screening there too. It
Yep.
probably is that one. So I was gonna offer that as well to have a screening tool and to have resources. I feel like children go to the nurse's office as their medical connection. That's a place of authority. So
Hmm.
having some information, pamphlets, places to contact. Sometimes people don't want to declare it in the school, but if they have the ability to take something with them and
Yeah.
talk about it or call or look into that, I think that would be really helpful.
Mhm.
And then also, I don't know if this fits here. I suppose in a way it does, but we're talking a lot about eating disorders, but for every client I work with, there's a disordered eating friend and who maybe doesn't have a clinically diagnosable yet by criteria eating disorder. But we have this very large wellness diet culture with a lot of disordered eating. So a lot of our students are suffering from the body image and the malnourishment and the things that come with disordered eating, even though they're not going to be identified. And maybe having more information on how to be a mindful eater, how to eat intuitively, how to recognize when your eating is causing you distress or causing you physical challenges. So that's kind of that broad thing that maybe we all need to focus on that, which is why we are working on safe school messages, because we
Yeah.
want the whole school to provide messages that don't lean towards disordered eating.
Awesome. And if you ever need any handouts from ANID, educators definitely reach out. We're happy to send some rat cards so that you can get connected to our peer support programs and just learn more about eating disorders. So, and disordered eating as well. You don't have to have an eating disorder to be able to reach out for help and to get support. Another demographic we've talked a little bit about them so far, but student athletes. So what can coaches do in terms of spotting disordered eating patterns, maybe concerns around excessive exercise, and how can they just in general support their student athletes who could be struggling?
I would love if, and this is some of the people we're working on training ourselves because coaches don't know what they don't know. If they haven't been given this education, they may not know the kind of messages and how to model behaviors that will at least help to not mitigate more of the eating disorder type tendencies. That's not to say that they're going to stop something, but if we work on the messages that come to our young people in schools, the authority places where they spend all their time, the coaches who are usually the revered person, we can at least protect the brains a little bit. That hijack is so vulnerable in school age kids. I mean, this is where the brain, all the neurons are forming, neuroplasticity is at its height. If we can help neutralize the messages, at least in the school setting, we know they're outside in the world, but if we can get our coaches and our teachers and our health teachers to do that, then the message that they're getting is at least a neutral science-based one there. And then they can make more sense as their brains build more insight of the outside world messages. So my answer to that, a little long-winded, is to model avoiding numbers where possible, watch the language they use. If you're talking about the body, can we talk about it in a way that is more neutral, not talking about body size, using more of a mindful approach, talking about adding things in that are good for their body as athletes, but not taking things away. So in other words, we wouldn't say that has too much sugar, don't eat it. We would say, have your Pop-Tart, but you want to make sure you can poop every day. So don't forget about fruits and vegetables, meaning adding things in, teaching them that they can have it all, teaching them to enjoy foods because every food, for the most part, creates ATP, which builds the glucose that feeds the cells. So at the end of the day, athletes, anything they eat is going to be turned into energy. So whether it's the Pop-Tart or the strawberry, they are going to use it. So educating themselves or finding out how they can get more education on those messages and then modeling that for themselves, maybe not supporting things like Fitbits and numbers and calories and things like that.
Yeah.
I know that's a big sell. Sorry, I had to say it.
Yeah. I would say definitely like kind of like avoid weigh-ins, like not do that and kind of like emphasize like more on like performance, strength, health, over like any weight or appearance, any like number, not comparing like athletes like in terms of like their appearance or like their weight and how their body is looking like on the court or like in the rink, like anything in that sense. Also, like watch for any like overtraining, like frequent injuries, any preoccupation with like food and exercise, like doing a lot of additional training outside of the sessions could also be a sign of like one like overperforming, but also like increase of injury, and also it could be an eating disorder compensating behavior. So that is definitely something that to look out for. Also kind of like normalize, of course, like rest, snack in between like sessions, kind of like before or like in the middle or after sessions. I know there are a lot of sports that take longer times, like especially like dance, skating. They are like there are like different sessions, like let's say like it might be followed by like some strength training at the very beginning and then some cardios, and then we go into court and like play that sport, like focusing on how to feel our body. Like a little bit of like quick tip is always like before going into like a training session or anything, take a little bit of like carb snack. I think something that's a little bit more simple carb, like let's say like a granola bar that's like easily digest, can be utilized in terms of energy within like 30 minutes or so. And then afterwards, like kind of like in between sessions, like maybe add also eating something that's like quick sugar. It could be even just a Gatorade drink or like a quick banana that could also increase a little bit of that glucose available and the energy available in your system that can prevent additional muscle injury or muscle loss. And then after the full session, actually have a full meal, increase the protein intake, also increase a little bit of carbohydrate intake to recover from the strength that is being lost. Kind of like a quick tip of like how to fuel for like sports. Of course, it's not pertain to like any specific like sports, but like this is definitely something that we can model and like help athletes, student athletes to like focus on increasing their awareness of like hunger, fullness cues, and also like normalize like rest and snack like in between sessions. So like making sure that they are actually performing well, focusing on the performance, the team work, the strength, not too much on their how much they weigh or like how they're looking in terms of like appearance or like comparison to other team members or like your competitors. So definitely that would be very helpful for student athletes.
You know, I wish we had a little mini training that, and granted, I think if you called up any eating disorder facility, us, ANAD,
Mhm.
any outpatient, any of us would be willing to come in and talk for 10 minutes
Yep.
with students, with athletes. I know at the schools we've been visiting, we've been asked to come to the psychology courses, the health courses, to be on the field. We can offer the right language because sometimes if you bring in a nutrition approach, they may not understand eating disorder nutrition, which
Mhm.
they're different. And that sounds a little odd, but this specialty, you want to make sure that the messages that are given are really from a disordered eating approach. So maybe just asking for help, someone to help educate your students and athletes.
Yeah.
Yeah. Yeah, another great resource that I'll throw out there is Running in Silence. So my friend Rachel Stile actually founded Running in Silence, which is an organization aimed at educating coaches and trainers and stuff based upon her own experience with an eating disorder as a college runner. So there's definitely a lot of resources out there. So don't be afraid to reach out. Another topic I wanted to explore when it comes to supporting students is what about those students who are maybe currently in treatment, but they're still at school or have stepped down and they're returning back to school now? How can teachers and educators support them?
I'll start just because I know
Mhm.
Zoe will have a lot on this because you're on the IOP
Yeah.
PHP level, but being on the outpatient level, we're usually part of that. The one thing I would say is definitely work within an interdisciplinary, or I guess that'd be a multidisciplinary team. I
Mhm.
work with the the school principal, the teachers, the school counselor. I kind of get my nose in there and we all team up to support them, both academically and then with the pro-social, getting back into school, the social emotional. There's a lot of anxiety. School avoidance can be a problem with that. And then finally, for especially younger kids, if they're gone, you have this developmental delay from wherever their eating disorder kind of set in, and it's helping them get back to where they started, which can again be on a lot of different layers, and helping them get back to that level kind of requires everyone to pull those resources together, and understanding that they are going to have some delays across the boards because they've been away, because their brain's been hijacked, but they will catch up. It takes a year or two, but they catch up.
Yeah, so a big part of our PHP step back down to like school, oftentimes our patients and students are still like in quite a bit extensive. So like they will still be in IOP like after school. So thinking about that, they are still in program for after school for 3 hours, and then knowing that they were already in school for like 6 to 7 hours in the day. That's a more than a full-time job, like coming like going to school in the very beginning of the day and then going to treatment for 3 hours at night. That is still taking a big chunk of their day. So like a big part of what we definitely would ask schools to be a little bit more lenient about is like, of course, their schoolwork and trying to excuse as much as possible, because thinking about that is almost like close to like 50 hours in just like sitting there in either the treatment center or in the school setting. That is quite difficult even for an adult. So like having that like empathy to like knowing that we want to do as much to help the student to succeed and go back to school. That's one thing. And of course, like in the eating disorder portion of it, there are a few things that I most of the time would talk to the patient ahead before they go back to school. Is thinking about do we need PE excuse like gym or like physical activity excusal? What is that looking like if they are a student athlete, and like what does that training schedule is going to look like, involving the coach and like under making them to understand what how much time and what type of intensity can this student participate and go back to. Again, is also a big part of what our conversation is. In terms of like school wise, like there are times that could be like, oh, can we have this teacher be like okay with like the students snacking in class, or like making some exception of like to make sure that they follow their meal plan, eating in a structured time frame. Is also going to be something that we talked about, and needing support from school. Also, like providing a safe space for like a lunch, right? Sometimes it could be a very overwhelming time at lunch when there's like thousands of people in the cafeteria and trying to get food, and like they don't have access to like microwave stuff like that. Can we also like work with maybe teachers or like some staff that's available to let them use the microwave, let them use the fridge, or like have an access to a safe and space, or like a teacher's classroom that they're more open and willing to like give the students a space, maybe even a supervised lunch, just like have some accountable person to eat with them at school to like alleviate some of the stress, or like take some accountability, like help them to hold the accountability piece for them. Those are some big parts that the school can support. Like also there are going to be probably like topics about like kind of like health related, like kind of like health class, and if the patients could be, or like students can be like excused themselves like in a way that's like that day would be okay, and not be the target, or like not be the person who like people go ahead and like ask them all the questions when they just got out of a treatment center. It's also something that we can work with the school and say, hey, if we know this is a topic that's coming up, can you let our student know ahead so like they can choose to be participating in this class or not? So, like that's also something that we would like kind of address like before they going back to school. Also, a big part of it is also just not like kind of like not focus on what happened to them, but like focus on how to include them back and like invite them back into the space. Like people would struggle, like every one of us can struggle with some type of mental illness in any time in our life, but like not ostracizing them, not like making a very specific, like also teaching them how to like answer questions if peers or teachers or anyone is like curious about them and how to like help them to navigate away from those situations if they don't feel comfortable answering are also things that we can help to support and just like identifying a safe person, staff member that they can check in with, kind of like practice those skills or like practice like, hey, yeah, I was just out for like some family matters for a little bit. Like kind of don't have to like fully answer the questions and have giving them ways and tools, people to go to when they're re-entering the school setting is definitely providing a little bit more safety and protective factors for them to return to their school life.
And if they're college level, I'm not sure who's what age ranges we're dealing with, but the student accessibility departments at the colleges have been wonderful at doing what Zoe talked about, helping acclimate them, giving them extensions, providing a safe person, giving them accommodations. And that's usually just by asking. So if you are thinking of college student, you can get those same accommodations by just asking.
Yeah.
Amazing. Well, those are some awesome tips on how to support students. So thank you for sharing all of those. Well, as we enter the last few moments together here today, I really want to dive into reducing risk and getting back to talking about that food noise and the diet talk and all of the things that can kind of contribute to an environment where eating disorders just blossom. So, what are some tips on how schools can get more involved in creating an environment where students celebrate body diversity? They have media literacy training, and how can they keep staff aware and engaged of eating disorder warning signs?
PD trainings.
Yes,
If there's any
definitely.
administrators, please let us come in on PD days.
Mhm.
That's kind of what we're working on through the whole institute is coming into professional development and giving the training that to your point, it's so hard to know how to give someone all that information.
Mhm.
But to sit in space for an hour, we give resources, we give tools, then we create a connection. So if you're not sure how to approach a topic, you're not sure how to do some kind of a assembly on this, we can walk you through it. And then to just be able to keep an open conversation about food, mindfulness, disordered eating, and make it open so that everyone
Mhm.
is chatting about it and not pretending like it's not there. I think that
Yeah.
that's a huge part of it. And then what I already said before is the three B's. Food is nutrition, avoiding body comments, and working on intuitive instead of numbers. Those trying to create a school culture around that where the
Yeah.
whole school buys into that is kind of a trickle down theory would be a wonderful way to make it easier for kids not to get caught up, at least in the academic setting.
Yeah, just like making yourself available for like people, like students to come to you, is just like knowing that like you are the resource, you are a safe person that they can go to is always a plus, right? There's always like having some people that they can, like an adult that they can trust, adult that they can go to, is like making yourself available and being okay in talking those topics, like being okay to like sit with them in discomfort, being okay to like give a little bit extra time and attention and empathy to like we're during this like difficult time that they are going through. Also, of course, like celebrate like body diversity in different maybe like posters, like even incorporating in curriculums, like languages, things like that. Like not just right now, we're like in a time of social media and there's a lot of like different diet culture, body ideals, influence on that. Like being able to like, hey, like it's okay to like read those things because we can't really avoid them anyway. But also kind of like learn how to like fact check, look for like reliable sources, knowing if they're advertising for a different company, like having those knowledges can like spot easily, like say, like if it's a social media post and like is this person being sponsored by a big food company? Is this person being sponsored by a big pharmaceutical companies? Like also like looking at if there are articles or like things that you're coming across or like some like diets. Also take a look at the authors. Like are they a dietitian? Are they a medical doctor? Are they just some type of authors that does not even have a medical license or degree. There are things that could be like easily spotted, but also being like kind of like approaching it in terms of like a curiosity standpoint, not saying like, oh, that's like not valid, but like going into it saying, yeah, like we can look at it together. We can like approach this together. We can like actually take a deeper dive into like what you're currently looking is a great way to like kind of like open that conversation and making yourself available and not making them feel judged like on the information that they're given, which unfortunately there's way too much information right now, and we it does require a little bit extra time and a little bit of like additional knowledge to like know how to spot the odd one out or the one that is like not creditable. So like that's definitely something go into it. And also when we're training people, it's not just like PE teachers, not just gym teachers or health teachers, is everyone that's included in the school, like academic coordinators, counselors, principals, staff, like all of them. It can take a part in this and be beneficial from this training, not just the people that might be a little bit more involved in terms of like gym or health wise. It is everyone that could take part into this supporting the students that and can of course like help us to provide a little bit extra like eyes like more pair of one more pair of eyes is helpful in this situation, so everyone can be a part of it and try our best to like catch them as early as we can.
I like to steal Jillian Lampert. I interviewed her. She's from the Emily program. And instead of talking about body image, which we hear a lot of right now, she calls it the body experience. And I love
Mm.
that because it encompasses not just what I see, not just what I feel, everything about me is a body experience. So maybe again, just trying to change the language so that we're making it more about who we are, not what we see.
Ooh, I really like that. Yeah, I haven't heard that one before, and Jillian's awesome. So yeah, that's really cool.
Stole it. I told her I was going to steal it. I said, girl, I'm running with this. So
Yeah.
yeah.
Well, shout out Jillian if you're watching this ever. So, yeah. All right, everyone. Well, we're reaching the top of the hour here. This has been an amazing conversation. I've learned so much. I hope that everybody who's either with us live or watching this recorded has learned a lot too. Panelists, do you have any last thoughts you'd like to share before we close out?
I would simply say, shame lives in the silence. So if we want to take stigma away, if we want to open up conversation, we need to have it be loud. And that will help with the food noise because we'll all be talking, not just hiding it in people's brains.
Yeah, definitely approach it with curiosity, care, and empathy. And kind of like going in as a person who just like genuinely concern and care for the students, like that is already a big step in the way. And instead of like saying like I saw this, I saw that, and it's like I want to show up for you. It's definitely one of the things that I want people to take away with is I want to be the person who you can go to, and I want to be the person who show up for you in this difficult time.
Amazing. Well, thank you. We will leave it there. This was fantastic. So, thank you both. Again, thank you everybody who's attended or who's going to be watching this later on. Again, always feel free to reach out to Anid if you need support or have any questions. We're here to help in any way that we can. So take care, everyone.
Thank you.
Thank you.